Okay, I'm going to check your eyes now. First, I'm just going to check some of the reflexes in your eyes. So I just want to look at a little bit of reflex. There we go. Now I just want to look at your eyes. Can you look at me? Big. Okay. Pupils are round and equal, and they do react to light and accommodation. Now, I want you to cover one eye and look straight at me with the other. And I want you to tell me just with a yes when you can see this light coming into your field of vision, okay?
Yes.
Okay.
Yes. 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 Yes.
Okay. So your confrontation is all good and normal. It's excellent. Next, I want to check your cardinal fields of gaze. This is a little bit closer vision. So I want you to just look straight at me, and I want you to follow the light with your eyes, okay? Good. Excellent. And that's all normal findings. And now we're going to check your eyes with the Snellen chart. So if you could, I've already measured 20 feet for you. Do you wear glasses on a normal basis?
Just reading glasses.
Okay, so you won't need them for the first test. So you just stand back at that line. Now if you could, just pick the lowest line that you can see clearly and read it for me.
E, D, F, C, Z, P.
Okay, so that was line 9. You can't do the next line?
F, E, L, O, P, or O, F, Z, D.
Okay, so Mr. Ellis does have 20/20 vision from the distance. All right, if you'll come and sit down, we're going to do the near vision. And since you do wear glasses, we'll let you wear those for this. We're going to hold this about 16 inches in front of you, and I want you to read the lowest line that you can read.
D, Z, E, C, L, F, T, O, F. L, P, T, O, F.
Try the line above it.
E, L, Z, T, G, O, F, P, D.
Okay. Your vision's just a little less than 20/20 there. It's about 30/20. But I understand when we were talking at the beginning, you told me you had just gotten some new glasses fitted, but they're not in yet?
Yeah.
Okay, so that will probably be corrected with the new glasses that you get. So we'll count that as normal then. We'll recheck that when you get your glasses. All right, any questions so far?
Nope.
All right, next I'm going to look at your ears. I'm just looking here at your ears to check them to make sure that there's no deformities, they're normal in color, and that they're even and symmetrical with one another, and they are. There are no piercings, there's no edema on either ear, and the ear canals are free from debris. Have you had any past history of ear problems?
No.
Do you have any hearing loss in either ear?
No.
Okay, great. I'm going to look at your nose now, and I'm just going to look at its size and shape and also symmetry. Your nose is symmetrical and midline in your face. There are no lesions and no bumps. You have any tenderness at all when I touch your nose?
No.
Okay, great. I'm just going to palpate your sinuses here, and you still also no tenderness?
No.
Okay, great. All right, now I'm going to look at your mouth. I just want to look at your lips first, and your lips are pink in color and normal. And if you'll open wide for me and stick your tongue out, I just want to look. Your tongue is normal in color also. The oral mucosa is good and normal in color, and teeth are clean. And have you lost any teeth?
No.
Okay, all teeth are intact. All right. I also need to look at your throat. If you can open and say "ah" one good time. Go. One more time. Okay. The throat is normal. There are no signs of any infection or redness. Next, I just want to look at your chest really quick and notate what I find there. Can I just raise your shirt? Would that be okay? Okay, so I'm looking at the chest, and the chest is flat and symmetrical, and there's no bumps or lesions. Do you perform the male chest self-exam ever?
No.
Okay, well, you know, men are at risk for breast cancer too, just like women. So they do recommend that they do that exam monthly, just like women. And I know it's overlooked in a lot of men. So I'm just going to quickly show you how to perform that and have you re-show it to me, and then we'll move on, okay? So all you do is you hold one arm up to the side you're going to check, like this. And you take your other hand and you start from the inside and you just move around, all the way around until you've worked your way all the way out. And you're checking for any masses, any hardness, any lumps. And you want to do that after a shower about once a month. Okay?
Okay.
All right. Now we're going to move down and check your thorax and your lung. Your trachea is midline. And your chest wall is symmetrical, and your rhythm, your chest wall rises in a regular pattern. Your respirations, when I checked earlier, were about 16 per minute, so that's good. They should be between 12 and 20. And you have no respiratory distress. Do you have any history of respiratory problems?
No.
Okay, great. I'm going to listen to your lungs now, okay?
Alright.
Okay, you're going to take a deep breath for me, in and out of your mouth as I ask you, okay? Ready? Deep breath in. Another. Okay, great. Okay. One more time. Okay. Okay, great. The lungs?
Is my phone, you want me to stop it?
The lungs are clear on auscultation, and you have normal breath sounds in all of your lung air, lobes. They're clear bilaterally, anterior, posterior, and laterally, and there are no adventitious sounds present. Next, I'm going to listen to your heart, okay? First, I'm just going to palpate a little bit and feel for the proper landmarks. We've got the aortic over here, and the pulmonic, Erb's point, tricuspid, and then the mitral. So first I'm going to listen with the bell, and I'm just listening to see if you have any murmurs present. There are no murmurs or bruits present, so we're normal there. And now I'm going to listen to your chest, okay? All right. Okay. All normal sounds is regular rhythm with no irregularities and regular rhythm. And you have no past history of cardiac issues?
No.
You do have high blood pressure, which you take lisinopril for, correct?
Yeah.
And that maintains it pretty well? Okay. And I did check your pulse earlier, and that was 71, so that's a good normal number for you. Okay. Next, I'm just looking to see, I want to check just your feet and ankles and legs for any edema you might have. That's swelling. Sometimes swelling can be associated with cardiac issues. I don't feel any swelling bilaterally in both lower extremities. And there's no edema in either arm, like bilaterally either. Checked your cat refill earlier, but just to reinforce, it was less than 3 seconds. Now I'm going to check your pulses. We're going to start with your carotid. And on the other side. Okay. Next, I'm going to do your radial pulses. And your carotid pulses were 2+ bilaterally. Radial pulses are also 2+ bilaterally. Next, I'm going to check your brachial pulse. Brachial pulses are 2+ bilaterally. And now we're going to check your popliteal. If you can just put your legs out, they're right behind your knees here. Okay, those pulses are also good at a 2+. And then I'm going to check the dorsal pedalis pulse. So you have good blood flow to your feet because you're also a 2+ there. And then the anterior fibular pulse. And that is also a 2+. So all of your pulses are within normal range. And we have no issues there. Okay, next, I'm going to just look at some of your responses and how quick they are, okay? Can you just open your eyes and close them for me? Okay, and I noticed that when we came in, we first met and we were greeting, you had normal eye-opening responses and normal verbal and motor responses to me. So those findings are normal. And I would give you a 15 on the Glasgow Coma scale. You have no deficiencies there. You're alert and oriented. Do you know what day it is today?
Saturday or Sunday.
Do you know what year it is?
2014.
Okay, and do you know where you are?
I'm at my house.
Okay, great. So you are oriented ×4 and well responsive. All right, next I'm going to test some of your cranial nerves. First I'm going to look at, if I can find where I put my pen light here. There it is. I'm going to look at cranial nerve number 3. I'm just going to look at your pupil size and your reaction. Pupils are about a 2, and they're equal, round, and they do react to my light and accommodation as tested earlier. And again, they're a 2. And I did test accommodation earlier also. And he does react when I bring the light in quickly from the sides. Next, we're going to test the olfactory nerve, which is cranial nerve number 1. I'm going to give you something to smell, and I just want you to tell me with your eyes closed what it is that you smell. We're going to do one side of your nose at a time, okay? So if you close your eyes, first I'm going to hold this side, and then we're going to do this. What does that smell?
Cinnamon.
Okay, great. Now we're just going to do the other side. I'm going to give you another smell to smell. What do you smell?
Cinnamon also.
Very good. All right, so the olfactory nerve, cranial nerve number 2, is intact. Next, I'm going to test, in fact, I did test earlier, cranial nerves 3, 4, and 5, the oculomotor, the tracheal, and the abducens. When I did the cardinal fields of gaze, I checked all 6 positions, and he was able to tell me from all 6 positions where the light was coming from. So those cranial nerves are intact also, so that's a normal finding. Now I'm going to check your trigeminal nerve, which is cranial nerve number 5. I just want you to close your eyes, and I'm gonna test